Go ahead and get started. Thank you for joining us today. My name is Sandra Smith. I'm the Employee Benefits Manager at ACWA JPIA, and you may or may not be familiar with us. We pool together 264 water districts throughout California to provide the best available coverage to our member agencies to which your employer belongs. And one of those great benefits that we have available to members of our Anthem PPO plans, which includes Classic, Advantage, and Anthem CDHP, is Carrum Health. And so Ava is here to tell you about that benefit today.
Thank you, Sandra, and welcome everyone. As Sandra said, my name is Ava, and I'm super excited to be speaking to Carrum Health's benefits today, which ACWA JPIA has sponsored. So I hope you grabbed your coffee or tea. I know I have mine here, and I wish I could be there with you in person. However, we want to say thank you for taking the time to listen in today. So we'll be raffling off a $50 gift card to participants who complete a brief survey after today's webinar. So I'll be here for the next 45 minutes to 60 minutes, sharing important information about your Carrum Health Centers of Excellence benefit. A few housekeeping items. Please use the Q&A function if you want to ask me a question during the presentation. I'll do my best to answer it in real time. Otherwise, I'll be sure to respond after I review my presentation. Please note that the Q&A function is public, so any information you share can be viewed by all participants. Alrighty, so let's jump into it. So what is Carrum Health? Carrum Health is a special medical benefit sponsored by ACWA JPIA. Our goal is to make it easier and less expensive for employees to get the best care from world-class doctors at high-performing hospitals and facilities that we like to call Centers of Excellence, or COEs. And this is when employees need certain planned non-emergency surgeries. This program is completely voluntary, meaning that employees have the choice to get care through our program or with their in-network medical carrier provider. And we believe that JPIA employees deserve a better medical experience, and we will help connect you to the right care and the right provider. Those who are eligible, which Sandra mentioned, are employees, COBRA participants, pre-65 retirees, and loved ones enrolled in an eligible health plan. And that includes the Anthem Classic PPO, Anthem Advantage PPO, Anthem CDHP. If you are enrolled in an HSA eligible plan, you must first meet the IRS federal minimum deductible. So there are many benefits for you to use Carrum if you need surgery. However, we've highlighted the top 3 here. One of those, and most importantly, is the absolute best care. We know that it matters who your doctor is. So when you're going out to look for doctors, how do you know you're seeing the best doctor for your needs? Have they performed the procedure you need many times? That's why we put facilities and surgeons through a process to make sure they have the most experience, highest patient satisfaction, and the best results. We connect you to the best doctors at recognized hospitals. Secondly, there are no medical bills. Can you ever imagine never receiving a medical bill after receiving care? That's what you can expect when you go through Carrum Health. You will never receive a medical bill after surgery that you have to pay. If you happen to get one in the mail, we say send us a photo of it, and then you can shred it and forget it. JPIA covers all of your surgery costs. And what's more is that they'll cover travel costs for you and an adult companion. Thirdly, an easier experience. Employees have easy, secure access to a care specialist, plus all the resources to prepare for, receive, and recover from surgery. They provide you with support throughout your entire surgery experience. We take care of everything end to end once you engage. We guide you every step of the way. You can even use our secure mobile app to message your care specialists. Surgeries available to you include neck, back procedures For the spine, surgeries like fusions and laminectomies, bariatric weight loss surgery, heart procedures, including coronary artery bypass grafting and valve repairs, sports medicine surgeries for the shoulders down to the toes, as well as total joint replacements, including shoulders, hips, knees, and ankles. And if employees want to go register at carrum.me/ACWA JPIA to see all the procedures available to them. And I just had a question come through asking if I can elaborate on the CDHP plan process. If you have deductible remaining in your HSA account, you'll first have to meet that federal minimum deductible. We will collect that for you and report it back to your medical plan carrier, and then you'll be able to receive surgery through Carrum.
Ava, do you mind if I chime in on that?
Please.
So to have a health savings account, the IRS has certain rules, and we do not want to make it so that you aren't eligible to have a health savings account, which means that tax penalties could be triggered. The minimum, the deductible on our plan is $1,500 for an individual. The IRS says that the deductible has to be at least $1,250. So that you're not in trouble with the IRS, we do make sure that you have paid $1,250 for the year. So what happens is Carrum reaches out to Anthem and says, how much have they paid for care so far this year? They've paid $1,000. Okay, well, we need to charge them $250 and the rest of it can be free, because that way they're not in trouble with the IRS. So typically you've incurred some expenses by the time that you are referred to surgery. So that's a pretty fair example of how that works.
Great. Thank you, Sandra. All right. So at Carrum, we believe that a better patient experience starts with quality. So we do a lot of the upfront work to make sure we are only connecting you with the top 10% hospitals and doctors throughout the country. We use a quality evaluation that accesses over 50 data points to carefully select providers who achieve the highest clinical outcomes. And then every facility and surgeon guarantees their care through a 30-day readmission and complication warranty. And our focus on outcomes means each patient receives the care they need only when they need it, leading to many patients avoiding unnecessary surgery. On the right-hand side, you'll see some of these high quality and performing hospitals and facilities. This includes Scripps, Stanford Healthcare, Providence, and Corvetti Orthopedics and Sports Medicine. All of these are available to JPIA members and their eligible loved ones. So we also understand that navigating healthcare costs can be complicated and stressful, and you don't know how much your surgery will cost until after it's done, as you may end up with surprise bills. So on the left-hand side, you'll see that you may expect to pay over $3,750 if you got surgery through your medical carrier, which includes a deductible, copayment, and coinsurance. And then on the right-hand side, you can see with Carrum, you owe nothing because ACWA JPIA takes care of the cost for you. You can see on the bottom right that JPIA even covers the cost associated with travel. This includes meals, if needed, a hotel room, or even a rental car. If you need same day or outpatient procedure, you'll need to live close enough to a Carrum facility to have a loved one drive you home the same day. Travel costs like hotels, rental car, for example, are covered for you for inpatient procedures where you need to stay overnight at a hospital, like a joint replacement or a spine procedure. So I spoke to our mobile app earlier. The majority of our members access our mobile app where we virtualized every step of a surgical episode. This includes form filling and medical records collection to second opinion consultations through our centers of excellence and more. So you'll begin working with a patient care specialist as soon as you register and begin engaging with us. They'll help collect any medical records, be the liaison between you, your medical provider that you'll be working with through Carrum. And then you'll also have access to be able to see doctors, surgeons that you'll be working with, their profile, their background in education, residencies and fellowships, for example. You'll also get a real life estimate of out-of-pocket expenses compared to what you may be paying for through your medical carrier. And then lastly, on the far right screen, you'll be able to virtualize each step of the process, completing to-dos, making it easier and more streamlined for you to get closer to having a successful surgery. And we'll even connect you with post-op care if needed following your surgery as well. So employees can register for Carrum to learn more about the program any time of the year, January through December. There is never a fee to register because JPIA sponsors the Carrum benefit for you and your eligible loved ones. If an employee or an eligible dependent receives a recommendation from their doctor for one of our surgeries through Carrum, like joint replacements, neck and back procedures, heart or bariatric weight loss procedures, they can register and create a case to get started. They'll be asked a few questions to make sure they're ready to start working with Carrum Health, and they can even see how much money they can expect to save getting surgery with one of our surgeons. And I just received a Q&A. Is there a mileage limit for hotel stay? For instance, live in a certain area but travel to LA. And if you need overnight stay, then that's when a hospital or a hotel stay would be recommended. And inpatient stays, it's 150 miles to live within the Center of Excellence for you to be able to travel there and back for your procedures. However, for overnight stays, then a hotel stay may be in correspondence. This depends on which procedure you're receiving. So getting back to this slide, a care specialist will be assigned with an employee or a dependent right after they create a case to let them know what to expect using Carrum Health, learn more about the care they need, and answer any questions, as I suggested on the last slide. And we'll also, as I mentioned, we've simplified all forms that are usually confusing to complete, and patients can access these on the app using their phone or laptop. So they don't have to go to the hospital to complete them. And if they have any questions, they can always ask their care specialists. And as previously mentioned, we also collect medical records and images and send them to the surgeon of their choice in our program. They're able to do most consultations over the phone or via video chat from the comfort of their own home with their surgeon. And then if a surgery is necessary, the care specialist will schedule and help plan the procedure for the employee and an adult companion. And once they arrive at the Center of Excellence, they get to meet their surgeon in person the day before their procedure. The surgeon will be there to check on the patient after their procedure too. The entire hospital stay will be covered by JPIA if hospital stay is required. And this includes all of the costs, the surgery itself, anesthesiologist, labs, radiology, and medication. And then once a patient arrives back home, as previously mentioned, you won't receive any medical bills for your surgery. Instead, you'll receive continued support from our team. All right. And super excited to share that we have a special guest on today, Leslie, who would like to share her story going through Carrum Health. Leslie, would love to hear why you first reached out to Carrum Health and what your experience was like.
Absolutely. Thank you for having me. And I'm really excited to share my experience with Carrum and the surgery center that I went to. It was top notch and everything went so smoothly. And I'm still in recovery phase, but within a year, I should be back to full function. But I just want to share from the beginning because I had such a long, painful history of getting to the point of surgery. In August of 2020, I'll tell you what my physical therapist told me, and then I'll tell you the real story, because I went to physical therapy prior to surgery. And I told the physical therapist, I don't have a good story. And after he heard what happened, he said, no, you have a very good story. You attempted a front flip and didn't judge how close the dog kennel was. And that's how you injured yourself. That's a pretty good one. I like that. It's better than just, I was a klutz and I tripped. So I went out to feed my dogs one night and I tripped on the cement leading up to the dog kennel and I fell forward. In an attempt to catch myself, I grabbed onto the wire of the dog kennel and it ripped my arms up over my shoulders. So I dislocated and fractured my left shoulder. And so when I went to ER, everybody focused on the left shoulder, went to my own surgeon. Everything was healing properly. It was about a 4-month healing process. And I kept saying my right shoulder, and I want to preface, I'd previously had surgery on my right shoulder years ago. And so I know the pain and the feeling of what torn tendons are. And every time I went to my surgeon, I could raise my arm up over my head. And he said, if you had damage, you wouldn't be able to do that. He said, well, I have a really high pain tolerance, and I think there's something really seriously wrong with it. So after many treatments with physical therapy, I finally got my surgeon to agree to do an MRI. And when I came back for the results, he walked in the room with his head hanging low and said, I'm so sorry. Yes, you have significant damage in your shoulder. So when I finally got to that point, it was around April of 21. And my manager had just going through the process with Carrum and had surgery and had wonderful things to say. And I said, oh, well, I have the PPO plan as well. Now that I know what damages, tell me about the process. And she did. So I started got on the portal, and, there's a lot of information that you need to put into the system. I'm kind of prepared in doing stuff like that. So I was pretty quick in navigating that process of establishing, putting in my current doctor, where I'd been for treatments, all of those things. And working with the Carrum team was wonderful. And every time I'd get something done, they'd reply back, wow, you got that done fast. Thank you. So there was no hiccups whatsoever with Carrum in that process. I will tell you the slowest part of the process was getting my doctors and ER to send my medical records. And I had to make a few phone calls back and forth and say, have you not done this yet? So that delayed a little bit, but that obviously wasn't Carrum's issue. That was my own physicians. But once that was done and it was approved, or I don't know what the term is at Carrum, but I was able to talk with a surgeon at Corbetti and had a Zoom meeting with them. And it was wonderful to go through that. And I had told them, my whole history, previously having shoulder surgery, and that they had to open me up for my previous surgery. And he said, I've always been able to do orthoscopic. I've never had to open someone up. So I thought, well, this is good. Then I won't have another big scar. And so everything was approved, and my flights, my expense check for meals and incidentals was instantly available. And Corbetti called the schedule and they said, well, we can get you in next week. Slow down a minute. So we delayed just because of my work. And going to the center, actually arriving there was very impressive. Beautiful facility, clean. From the time I walked in, for the receptionist checking me in, you felt like a movie star. going somewhere. They just treated you so wonderfully. And just everybody was so concerned about my care and how I was feeling. The whole surgery staff, once I came in for surgery, everybody was, very supportive, asking me what my needs were, if I was comfortable. Just all I can say is just rock star. And when they use the term center of excellence, it truly is a center of excellence. I was extremely impressed. And then my coming home from that, I was concerned about a flight after having shoulder surgery, and it was no big deal whatsoever. And after having surgeries before, I get sick on pain medication, and Dr. Kerbetti said, well, I'll prescribe you anti-nausea medicine, which is the first time anybody has ever offered that. I took pain pills for 2 days. And after that, I was just on ibuprofen. And I'm not saying I didn't have pain, but I didn't feel that I needed more drugs than just ibuprofen to be okay. And just the healing's gone wonderful. And he said with the extent of my injury, because I had torn tendons, I tore my muscle, tore my rotator cuff, and then he ground down some previous bone spurs that he said, I think they could start growing back over time. So we're going to grind down those as well while we're in there. He did it all orthoscopically, and I'm best experience I've ever had with surgery, and the whole Carrum program was absolutely wonderful. People really cared. They checked in with me after I came home. Did everything go okay? How are you feeling? Anything we can do for you? And, a topper from a personal perspective as well is I paid $0 out of pocket. When I had previous surgery, I also had a PPO. And at that time, when I had that surgery, the surgery center and the surgeon, I paid almost $900 out of pocket. And then I was getting bills on top of that for anesthesiologists and different standby during the surgery. So I think that surgery cost me out of pocket like $1,200, $1,500. I'm just estimating. And this surgery cost me nothing out of pocket. So that was a major bonus as well as the good experience.
Thank you so much for sharing, Leslie. What a roller coaster. And I'm so happy that you're now in a better place, feeling more mobile, it sounds like, and in less pain. I know that you also had some great things to say about your patient care specialist, Allie. Would you mind sharing some details about how she helped you?
Yes, Allie, she was prompt. Every time I filled out a form on the portal, she would reply that she received it. There was just constant contact. She was funny too on some of the things that we were interacting about back and forth. So it gave a real human experience rather than just I'm on a portal. Pardon me. And she just, for lack of a better term, she just held my hand through the whole process and answered questions immediately. You think you have silly questions, and she's, no, nothing silly. And she was just, I really felt supported.
That's great. I'm so happy she was able to support you throughout the way. I'm sure it also brought some comfort too. Surgery can be scary sometimes, especially if you have to travel. So I'm happy she was able to take care of you. I don't know if there are any other questions for Leslie. I know we have a little bit of time here. You're welcome to put them into the Q&A. We'll give it a minute or so. I think there are some other questions here too. So does Carrum come in after you find out you need some type of surgery, prior MRI, scans, etc., are out of pocket beforehand? We will first collect your medical records, your recommendation for surgery, anything that comes in after working with us at the Center of Excellence or hospital or facility, that will be covered through Carrum. So anything in relation to your actual surgery after you begin working with us. And then how does the out-of-state healthcare approval process work. For example, I live in California and would like to visit Corvetti Orthopedics Sports Medicine Group in Nevada. So I would first recommend going out and registering with us with your recommendation of surgery. And then we can begin to work on selecting your center of excellence and hospital facility, figuring out what's the best fit for you. Christina, I would recommend going out to our website, which I'll go to the next slide, or giving us a call to begin the process with us. Okay, and it doesn't look like there are any questions for Leslie. So Leslie, thank you again so much for sharing your journey with us and your experience. I'm so happy that we were able to support you in a successful surgery and give you a great patient experience throughout.
Thank you for having me.
Thank you so much, Leslie. That was a great story, and wonderful to hear how much Carrum was able to help you. And I know that it's scary when you first get recommended for surgery, and I know that a lot of times your first question is, where can I find a good surgeon? Like, that's what you care the most about when you get that recommendation. And so the fact that Carrum has gone out and done all of this legwork and found really excellent providers and facilities for our membership is something that is just an invaluable part of this benefit, on top of the fact that it's at no cost and they arrange your travel for you like a concierge and all of that. I wanted to just kind of 1, 2, 3 step how it works at the very beginning, which is if your doctor gives you a recommendation for surgery, that's the time when you say, okay, I'm going to reach out to Carrum now and see what my options are to go through them. So the first step really is that your doctor is recommending surgery. At that point, you will be transferred to some sort of surgeon if you stay within your medical plan. And so you can also, instead of going to a surgeon within the Anthem network, you can go through Carrum and go to one of their centers of excellence. And who knows, they might be in the Anthem network, but then you get all of these additional bells and whistles through Carrum. And so there's a lot of talk about approval. And so if the initial recommendation for surgery, that's when that occurs. Carrum just makes sure that you are a good candidate for surgery, that's appropriate. They review your medical records and just kind of like, we second that. We agree that you're a good candidate for surgery. So that's kind of how that works. And that's the medical record transfer that happens at the beginning. So just thought that would be helpful for people to know how it all gets started.
Yes. Thank you, Sandra. I appreciate it.
Sure.
As I mentioned, I would first recommend just going out and registering with us just to see what the app looks like. Begin working with a care specialist to see if your recommendation for surgery is approved, and you can begin maybe selecting a center of excellence and looking into hospitals, facilities, and providers. And then you can access that by either going to carrum.me/ACWA JPIA, or you can call into us and ask any maybe personal questions you may have or general questions if you think of something after the call today. And that's 888-855-7806. And you can download our Carrum Health app from the Google Play or the Apple App Store. And we just had another question come in. Can anyone become a member of Carrum, or is it only offered through employers? So Carrum Health is a sponsored benefit by ACWA JPIA. So they're sponsoring Carrum for eligible JPIA members as well as eligible dependents to access this. So it's employer specific. We also have a few more minutes here if anyone has any questions top of mind that we can answer today.
Now mention too that we're recording this webinar and we'll send out a link. And if you'd like to rewatch it or maybe have your spouse watch it, if it might benefit them or they might be interested in supporting you when you're having the upcoming surgery and getting to be in the know, keep an eye out for that recording, just in case you missed anything or want to share it.
True. Thank you, Sandra. Yes, we'll be sending out this recording for Sandra to be able to post for you to view at a later date.
I need to hear things twice sometimes. So that's, I get that.
Well, it looks like questions have slowed down. As I mentioned, if you think of anything afterwards, please reach out to us through our mobile app, our website, or by calling in. Also, if you would like to receive, oh, we got a question. Quick question. Do you need to be a member for a certain amount of time prior to being eligible for this benefit? It is currently live for anyone within ACWA JPIA who is in those eligible Anthem plans, as well as any eligible dependents over the age of 18 who are enrolled as your dependent within those plans. Can HMO insurance plan also use Carrum? Currently, HMO plans are not eligible for ACWA JPIA sponsored benefits through Carrum. All right. So last thing, don't forget to answer the short survey that will be sent following this webinar for a chance to receive a $50 gift card. You're also able to answer any questions on there as well. And we'll have someone get back in contact with you with answers.
Thank you so much, Ava. Really appreciate it.
Thank you, Sandra, and thank you, Leslie, for sharing your story. We really appreciate it. And thank you all for attending today. The recording will be shared and posted at a brief later date. I hope you all have a great rest of your day. Thank you.